Hi, I'm Dr. Deborah Lascola with Cape Girardeau Urology Associates, and I'm here today to discuss the different types of urinary incontinence. Many patients are unaware that there are different types, and you may think, what's the difference? Why do we need to know about the different types? But we treat them differently. So during our first meeting with you and discussion, we will try to define those types of incontinence so that we can better direct the best treatment towards your care. In general, we have stress urinary incontinence, urge urinary incontinence, mixed urinary incontinence, which is a combination of those two, and overflow incontinence. With stress urinary incontinence, this is defined as the involuntary loss of urine during physical activities, such as common things such as coughing, sneezing, laughing, lifting, changing positions. This is an inability to store urine due to the outlet. So this is the urethra. There are factors that increase your risk for this. There are neurologic factors, having any kind of pelvic floor surgery or having a previous pelvic surgery can increase your risk for having stress urinary incontinence. Even childbirth can increase your risk for having stress urinary incontinence. The urethra is a muscle that needs to be dynamic and open and close, open when we need to urinate, and it should close when we're not urinating. But this elastic property of the urethra can be lost as we age and as a result of the previously mentioned surgeries. With aging, we have a lack of estrogen, and that definitely decreases the ability of the urethra to be flexible. Other connective tissue disorders can also increase the risk of having this type of incontinence. In addition, myopathies, anything that affects muscle tone can affect the ability of the urethra to do its proper function. With urge urinary incontinence, this is involuntary leakage of urine accompanied by or preceded by urgency. So this is an inability to store urine because of the bladder. This is often also defined as detrusor or overactivity incontinence. So if the bladder starts squeezing too much, you can have urge incontinence. Risk factors for this include, again, having had a previous pelvic surgery, or having any kind of injury to the pelvic region or spinal cord, patients that have had cancers such as uterine cancer, ovarian cancer, colon cancer. All of these increase your risk for having incontinence. Often these patients are treated with radiation, and this increases the risk of incontinence as well. Neurological diseases such as MS, Parkinson's disease, these can affect the bladder. In addition, having obesity or being a cigarette user can increase your risk for having incontinence. And then as we age, or if we have any kind of trauma to the pelvis, this will increase the risk for incontinence as well.